Do you want to relax tight muscles in seconds without oil or lotion? Welcome to the power of compressions. They can be used at the start or the end of a treatment and also great throughout. I'm going to use compressions to start the treatment. So let's say I'm going to do a back massage. Even before I remove the towel or put any lotion or oil on, I just start by using the heel of my hand here, either side of the spinous processes. Now, I don't want you to do it as a spinal manipulation, but I want you just to lean some body weight slowly through the towel into the muscles. And it does help you to feel the flexibility of the area. Now, if it gets to a point where you do hear a small crack or a little pop, it just wants to do it. I'm not doing it as a thrust. Okay, so to be clear, it's not a manipulation. It's more of a mobilization. So we're just leaning our body weight through and doing it as a compression technique. We're going to use a compression technique using the whole palm. I call it heel of hand compression, really. It's a little bit like if you're resuscitating in first aid. But from there, I'm just going to lean my body weight through. So straight elbows, leaning through. Hold for 5, relax. Come up. Lean on and relax. And I like to think of this as a sponge full of water. And if you lean on the sponge full of water, all the water will come out. And then as you take your hand off, fresh water will go back into the sponge. So it feels nice. It's quite relaxing. Shouldn't be too deep. And just watch the amount of pressure you're putting through. We can also do compressions with our elbow, and a great area to do that is right in the centre of the glutes here. So after a thorough warm up on the glutes, we can be a little bit more focused. Use your elbow there, and again lean your body weight through. Now we need client feedback for this. So on any pressure scale, on a 1 to 10, I wouldn't go any higher than an 8. Sometimes 6 or 7s are okay. But you just need enough so the client knows exactly where you are. And on this muscle, especially the piriformis, I think they'll be quite aware where you're working. Try not to use thumbs where possible, but up here is a great position for your use of thumbs. Once you've done a thorough warm-up of the area, a nice thumb compression is just where levator scapula, supraspinatus and traps are. It's a bit of a junction. So one thumb on top of the other thumb, lean your body weight in and hold that for about 5 seconds. Now, if you're working on a pressure scale and the client says you're on a 7 or 8 out of 10, with this compression technique, you can get them to do 3 slow, deep breaths, which then becomes a neuromuscular technique. So applying compressions with deep breathing is a really nice way to try and relax that area. And when it starts off as an uncomfortable 7 or 8 out of 10, it can finish after 3 breaths at about 3 or 4. At the end of a treatment, I like using compressions a little bit like I did at the start, but I don't tend to hold it for quite as long. And even if I've just done a back massage, I tend to compress all the way down the back line, if that's how we finished, through the glutes, through the hamstrings. Just watch pressure on the back of the knee, onto the calves. And this really tells the client that you're just about to finish. Rather than finishing with an effleurage technique, I think that's lovely. And thank you for watching.